You got to read, and filter through all the crap, right? So in this case, what's important? You hit this if you need it. You're not using UWorld, you use AMBOSS. It says, hey, listen, loud S1, loud S1. Okay. What are they trying to what are they trying to signal or help you learn or try to push to you with the immigration from China? Why they tell you she came from China 2 years ago? Why? What does that mean? What does that mean? Yeah, or that's just because rheumatic heart disease. Sure, of course, right? It's a underdeveloped country or immigrated from developing countries, they call it. So a person that travels from other parts of the world, they're trying to push you to rheumatic heart disease. Okay, so rheumatic heart disease, which valve is usually the valve that has problems or issues? The mitral valve. Very nice, right? So 100%. So right away you can say, all right, where's the mitral? Let's just tricuspid out, aortic's out, contractions out, valve opening out, fillings out, boom. Not difficult. 84%, yeah. But you know what happens now is, do you know everything you need to know about mitral stenosis or regurg? In a patient with mitral stenosis and mobile leaflets, a loud S1 is often present because of increased left atrial pressure. I would suggest if you get an answer right, if you don't want, this is me and you now talking, right? We're a team here, guys. I'm trying to teach you guys the best way. I know all of you have watched videos and read books to a point. I wouldn't want to go back to it if I was you because it's too much, right? But if you need to be honest and say, well, if I don't know it, I got to go back. Or you take a little more time and say, well, this information here is pretty good to cover mitral valve closure, right? And then you say, well, they teach you everything. They teach you about atrial pressures. I mean, if this is how you want to learn, clearly, this is a way to learn. Other times, people are like, hey, man, I got to go back and watch a video. But watching a video, eventually you start like, the mind kind of checks out because you've seen it once or twice or thrice. It's like, well, unless you're physically writing notes, taking a maybe pausing every 5 minutes, you're not going to really absorb it all. So I think by taking 20 minutes instead of watching a video, you could say, well, I can go through all this individually and understand why each one is wrong, but this is right. And I think it's a lot more advantageous for you. It's more like hands-on, I think, and it kind of works. They love asking about S1, S2, rheumatic heart disease, guys, ladies and gentlemen. I can tell you, I can guarantee everyone's going to get a question on rheumatic fever, rheumatic heart disease. By the way, rheumatic fever, what example of hypersensitivity is rheumatic fever? Is it 1, 2, 3, or 4? Rheumatic fever. Fever. You guys watch Saturday Night Live? Like I used to always, I got a fever. And it's asking for more cowbell, right? Christopher Walken. What an amazing character. Yeah. So type 2, yeah, fever type 2. Yeah, fever. So I think of it this way. Fever is 2 E's. Oh, I sent it to my friend. I'm sorry. Let me do it again. Fever is 2 E's, fever. So when you go here, you type in, let's say, Coombs test. You get comfortable. You know where everything is in first aid once you've done it a couple hundred times. Rheumatic fever is right here, right? So this is something where we did immuno last week, but as you realize, I know what I've taught you guys. I know what questions I've selected. So as the days and weeks go by and the months go by, I bring things together for you from week 1 to week 2, week 2 to week 3, and so on. So this is something in immuno that you should really master. It's not difficult, but they have tons of questions. They ask you about this different Don't think that knowing first versus delayed is enough. It is not enough by all means to answer any of these questions on step. They ask you about examples. They'll give you the example. You need to know it. Or they ask about the mechanisms, okay? So in this case, rheumatic fever is 2 E's. A quick review. IC type 2, I think anything 2s, meaning myasthenia gravis, Graves' disease, pemphigus vulgaris, bullous pemphigoid, good pastures, hyperacute. What is acute and GVHD? What type is that? Acute transplant rejection and GVHD. What type of hypersensitivity is it? Type 4. You go down here. Type 4, you have 4 T's. You have T cells, transplant, TB, touching. Remember, G, VHD, 4 letters, type 4. Also acute. If you go up here, and they don't have it here actually, but it's also type 4, fortunately. First day doesn't have everything, right? But be careful because we get caught up with what we know. Remember, familiarity, and then you don't actually review it. Just take my word on this. Every time you come across something you're familiar with, say, I'll take 2 minutes, 2, 3 minutes, and review, even if I know it. But I'm going to review something. I'm going to review it and try to grab something I don't know about it. That's what I started doing years ago when I teach students and I coach them and mentor and tutor them. And I realized that I strengthened my knowledge practically overnight because every time I thought I knew it, there was something I didn't know about it, right? So I'm like, what else can I grab from it that I didn't know before? And next thing you know, I'm like, I saw, Graves, or I saw GVHD multiple times, and everything would just pop out like this. So quick summary on GVHD. It's usually bone, right? And then on top of that, they'll tell you it's bone, like a bone transplant, obviously. And then on top of that, they'll talk about systemic problems, skin problems, GI problems, liver problems. So they'll give you a systemic symptom presentation versus the other transplants are different. So they tell you somebody who, had issues, who had a bone cancer and they had to do a transplant. And basically they have skin issues, jaundice, liver problems, diarrhea, systemic issues, always GVHD. So that's how you teach. That's how you learn fast, by the way. Okay. It's all about referencing. Okay, cool. So you see now, you can't run away from micro. I'm sorry, but if you're pretty good in microbiology, bacteria, viruses, fungi, and parasites, and you're decent in immuno and biochem, you can kind of cover a lot of points in your organ systems because every organ system, heart, lungs, kidney, neuro, they will have micro. They will have immuno. They will have biochem. You just got to master the points, right? So go through this, and I promise you'll get points. I know it sucks because cardio is not easy, but you got to do it. Check this out. Don't panic. Please don't panic. Don't have a heart attack yet. I don't have any issues, right? Check this question out. This will give you an angina, I think. But hold on a second. Does this look like anything familiar to you? Maybe. But don't break the rule. Let's look at the scenario first. Let's read the scenario. And then if we don't know what's going on, we can then go ahead and look at the picture, right? Yes. Okay. So last 3 lines always. And I don't know about you, but when I was studying for this a long time ago, I used to put my finger covered pictures